Okay. Hello everyone. We are at ICM 2025 and I'm with Ahmet Alanay. Welcome.
Thank you so much for having me here.
Okay. Thank you.
Let's start.
Yeah. You
Okay.
can start.
Okay.
Okay.
Now you can ask your questions.
Yeah. Could you please introduce yourself for our audience?
Yeah, sure. I'm an orthopedic spine surgeon and I'm the director of Acıbadem Maslak Hospital Comprehensive Spine Center. And I'm a professor also at the Acıbadem University School of Medicine.
Okay. Thank you for the details. And I have some question about the infection. Why does the infection matters for you?
Well, in fact, as I'm a spine surgeon, we can see in our patients two sorts of infections. One of them is the primary infection that we see maybe less often than before, but tuberculosis had a historical importance, and still we are seeing this sort of pathology. It has not been completely eradicated. And that has been, one of the major reasons for spine surgery in the years 1950s maybe. And also we can still see some infectious disease in those patients who have some immune system defects, like cancer patients or other immune diseases. So these are, especially in spine, very difficult to treat disorders, and also as there's a spinal cord, carried by the spinal column, these infections may also end up with, some neurological problems and leaving the patients paraplegic. So yeah, and it is very difficult to eradicate the infection from the bone, and when it's a spinal bone which has, good. A big number of vessels and very good vascularization. These are really problematic disorders for us, so difficult to manage. That's one of the reasons. The second reason, we may have infections, we may see infections especially after the spinal operations, and especially in the last 20 years, spinal operations has been like very pandemic in the elderly population for those patients over 60. And as they are more fragile, they are more prone to infectious diseases. And especially as we are using a lot of implants in those patients, to fix their spines. Infection in a bone where there's an implant is really a big mess, and it's very difficult to manage. So we have to keep all our preventive measures to avoid the infection. And we are really becoming very aggressive to treat those patients. I mean, it is, of course, decreasing the quality of life of patients and, causing complications, but also it's causing a lot of, high costs and not good for the healthcare economics of the countries.
I want to learn about your feeling about ICM. What ICM means to you?
Well, I mean, ICM is very new for me because I believe this is the first year that ICM also discuss about the spinal infections. So this is my first year. I think spinal infections, we don't see them, that much as we have seen before, but still a huge problem. And it is always neglected because the spine disorders are, we have so many different problems. Maybe we see more than the infections. But as this is something, a neglected topic, I think this was a great idea to bring all the spine surgeons, to have a consensus of, first of all, how to prevent, and then how to treat majority of, those infections. We will start today, with our session, the spine session, but I'm 100% sure that, and also I have seen during our preparations for this meeting, there was not a huge consensus between the surgeons from different countries. So if this can provide a consensus really, after all these discussions about the infection, I think that would be a great help, for our patients and for surgeons to maybe to be able to manage these spinal infection disorders easier and more comfortably.
You attended so many congress and meetings, as I know. So what's the difference of ICM?
Well, this is not a regular meeting, so I don't. There's no didactic lectures, or there's not too much new science presentations, oral presentations, symposiums. This is a consensus meeting. So this is actually quite popular nowadays in science, by doing kind of Delphi studies. So, we just look at the literature, and then first we see what the literature is saying. And of course, there is always a controversy also in the literature. But now, I think this is a fame of spine surgeons, because there are all the celebrity spine surgeons from all around the world here, all these academic guys. It's a great opportunity to bring all these guys and then, discuss about the situation very shortly, and then learn their opinions, with the voting. And then, seeing a consensus or bringing a consensus, on those very controversial topics. I think this is a completely different meeting style. We try to do this as a part of, our annual meetings, but that is very limited time. But this is, a day and a half, discussing about several problems where we have controversies. To have a consensus is a completely different meeting style, and I don't think, this is done elsewhere in the world.
Okay. So, as a final question, is there anything you want to say about the ICM?
Anything I want to say about the ICM? Yeah. Well, again, I mean, this is a great initiative, and especially the very first one for spine, but I'm sure there will be more and more. The other thing that I should say, as one of the members of the Acıbadem system, I'm really very proud of, all the ICM team, especially Javad Parvazi and our International Joint Center. And and I am really very grateful for them, for bringing all those people to Turkey and having them with us, and all their efforts, to help to solve this very important, infection problem. This will be my first time, and so I don't know actually how it will go. Maybe if I would do this interview, I would say something different, but I'm 100% sure that this will be a great meeting. So I hope this will continue in the coming years, because I don't think that we can solve and get a consensus about all these controversial issues, in a day and a half.
Okay. Thank you for your time.
No problem. It's a pleasure. Thank you.
Okay, my pleasure. Thank you.
Oldu mu?